Welcome back. Tomorrow is World Contraception Day. The aim is to enable especially young people to make informed choices about their sexual and reproductive health. Well, South Africa has a high incidence, as we know, of teenage and other unwanted pregnancies. Let's discuss this further now with Dr. Makgoale Magwentshu from Ipas South Africa. Doc, a very good morning, and thanks so much for your time. Just looking at what the focus is this year, it says the day is going to center around a vision where every pregnancy is wanted. So I just want you to clarify that for us, because I wonder if this is bound to become a pro-life or pro-choice discussion at some point, just in the context of the message you want to get across tomorrow.
Thank you, Eureka. The message I would like to get across for tomorrow's very important day, the World Contraception Day, is the fact that women, girls and young boys have a right to sexual and reproductive health. And part of this right is, of course, based in the Constitution. The Constitution allows them to express their sexual need according to their choices. And the government, of course, has worked in collaboration with various stakeholders, Ipas being one of them, Global Health Strategies and WHO, and a whole lot of them, of course, including the CBOs, the community-based organizations, and the communities as well. So the message that we are sending out there for our community is that contraceptives are available in the public health sector free of charge. These contraceptives are made available. The government and this various partners have trained providers on how to go about counseling women, girls, and boys on their choice on contraceptive services. Well, in the event the contraceptive services don't work, they really need to go back to the public facilities to go and share their consent with the healthcare providers.
Well, Doc, just to clarify, this is not an anti-abortion stance that you're taking in this message, where you say the vision is where every pregnancy is wanted, because every pregnancy might not be wanted. But you are advocating giving them the choice and giving them the information to make the choice that's right for them.
Yes.
All right. You are also focusing on women who have certain chronic or pre-existing conditions. Why, in particular, this group of women?
Women who have chronic diseases, who have certain diseases that to be aware of, also are having a right to enjoy their constitutional right to have access to the very safe contraceptive services and safe abortion services. The issue out there is that women with these various diseases have experienced unnecessary judgment at institutions of health, and communities as well have judged them unfairly. So the message that we are sending here is that they should be respected, and they should also come across and have a voice and have a choice in making sure that if they choose to fall pregnant, the choice should be an informed choice. And if they choose to prevent this pregnancy, they should have access to safe contraceptive services. And in the event the pregnancy is not wanted, South Africa has a liberal law, Choice Termination of Pregnancy Act, that was passed in 1996, which allows every woman to have or to choose safe abortion if she so feels like choosing it.
So are we having the correct discussions with our kids? And let's be frank about it, we need to be having these discussions much younger than ever before. I mean, we have our kids experimenting at a very, very young age. We hear about 10, 11-year-olds who are pregnant as well these days. So are we having the right discussions? Are we saying the right things to them? And are we doing it on the right platforms?
I guess I'm tempted to say no. Most of us as parents, as colleagues, as organizations are not having the correct comprehensive sexuality education with our kids. And for that reason, our kids then resort to their friends, their colleagues, who of course are just as uninformed. So the message that we are sending here is that we as parents, as family members, let us have sexuality education that is of course age-related with our kids, and understand the fact that if we don't give them or equip equip them with valid information, our kids will go out and experiment, and regrettably will be faced with the unwanted teenage pregnancy. And some of them then resort to going to use the services of unscrupulous providers, which of course offers them unsafe abortion, and in the process they lose their lives, or they lose their willingness to live after an unsafe abortion.
Dr. Magwentshu, if I can ask you just very, very quickly, what about those parents who feel if my child is young and they're not asking me about sex yet or not asking about prevention, if I have this discussion with them, I'm going to introduce the idea into their heads, and also if I talk to them about contraception and say, this is what you need, if I talk to my 16-year-old and say, I'm going to put you on the pill just in case, that they're giving them a passport to go ahead and be sexually active. Is that a big concern, and how do we deal with that?
Yeah, that's a big concern. Some of the parents feel if they do, as you correctly said, they initiate the sexuality education, they will then be promoting sex. They will then be encouraging their young ones to indulge in sexual intercourse. So what we are saying here, Rebecca, is that parents also need to be educated. Parents should not be left alone to make these decisions by themselves, because the very parents haven't got the skills, neither do they have the information. So it's important that as communities, as organizations, we also involve parents on the importance of sharing this information and the skills with their young ones. Of course, we have statistics of pregnancies and unwanted pregnancies, so parents must be aware of and be supported to continue with this important comprehensive sexuality education of their children at a very young age. Of course, the education should be age-related.
Thanks very much. Dr. Makgoale Magwentshu there, thanks very much for that. And yes, tomorrow is World Contraception Day, and pay attention if you're a parent.